James was a rather complex case. He was initially seen by another surgeon for an extensor tendon rupture. So essentially he came into the office unable to straighten his fingers. Had a great operation performed where the tendons were fixed. Was doing fine with therapy post-operatively, then suddenly his fingers were hanging down again.
Well, back in August of 2014, I noticed I was having throbbing pains in my left hand. Nothing really serious, but it was more like I just couldn't move my fingers as well as I usually did, and that kind of troubled me. But then I started getting more and more pain towards September. I'm semi-retired, but I play piano and organ part-time, and I noticed I was having some throbbing pain in my left hand, and it was getting worse, and I noticed it was really becoming more and more difficult just to play anything with the left hand.
In talking to James about his problem, the key question was, why? And he didn't have an answer, and together we figured out that he actually had significant arthritis of his wrist that was wearing on his tendons and causing his tendons to rupture. From there, James and I made the difficult decision of deciding to go back to the operating room.
It was devastating, really, because I couldn't keep the job. It wasn't like, hey, I've got a little problem with my hand here, I need to get it fixed, or that kind of thing. It was major surgeries.
The operation I ended up doing for James is called a Sauve Kapandji Reconstruction. It's a complex operation whereby I take the joint between the radius bone and the ulna bone and I fuse it. I turn it into one bone. But to allow you the ability to continue to rotate, I actually cut the ulna bone and transfer tendons to keep everything right where it belongs, but keep that function.
When you have something like a problem like this with the hand, it's so important that you do the therapy that they tell you to do. The 3 people I worked with were wonderful, and they just took me step by step through the procedure. So if anybody, heaven forbid, has to go through something like this, do what they tell you to do. If they give you exercises to do at home, do them, because you have to get that strength back, and with the strength comes flexibility.
He ended up with just a fantastic result. He has all his motion, he has no pain, and his fingers work fantastic. So I'd say he's a home run.